Hello, my name is Gloria and I'm one of the midwife sonographers in the early pregnancy unit. Normally, the first scan is at your booking visit and it's usually between 12 and 14 weeks. But if you have experienced any bleeding or a history of ectopic or a history of recurrent miscarriages, they might refer you to the early pregnancy unit when we will do a scan in there. The routine maternity care in Ireland is free of cost, so you don't need to pay anything. The aims of an early pregnancy scan is to determine that the pregnancy is in the correct place, the viability of the pregnancy, how many babies are there, and to determine the gestational age to see how many weeks you are in the pregnancy. We can see the heart beating of your baby from around 6 weeks, but we will be able to listen the heartbeat after 12 weeks in the ultrasound scan.
Hi, my name is Gemma Owens. I'm a clinical midwife specialist here in the Rotunda Hospital and I work in the ultrasound department. All you really need to do is drink enough water before you come in for your scan. So that means drinking about 500 ml of water 30 minutes to an hour before you come for your scan. And that means that your bladder is going to be nice and full, and the full bladder acts like an acoustic window for the ultrasound beam to penetrate through and help us get lovely views of your baby, hopefully anyway. Bear in mind when you come in for your scan, there can sometimes be delays while you're waiting for your scan. So if you really need to go to the toilet, then go off to the toilet, empty your bladder, and then come back and start drinking a few cups again before we hopefully call you in for your scan then. The first booking visit scan appointment is 15 minutes in total, but the scan part of it actually usually only takes about 5 minutes. So first I'll bring you in, I'll ask you and your partner some questions about your last period date, if your periods were regular before you got pregnant, if you were on any hormonal methods of contraception before the pregnancy. So if you have all of that information with you before you come for your scan appointment, that helps us a lot. And then that brings us on to the exciting part, the next part where we do the scan. If your bladder is nice and full and if baby's in a nice position, then the actual scan part should only take about 5 minutes. Some instances where the views on the abdominal scan might be a bit more challenging would include if your bladder's not adequately full, if you're not as far along into the pregnancy as your dates would suggest, if the baby's curled in a difficult position, or if you have a lot of weight around your abdomen. For the larger ladies, that can make getting views of your baby through the abdominal scan a little bit more challenging. In some of these instances, we may need to suggest doing a transvaginal ultrasound. This is an internal scan where a transvaginal probe is inserted into the vagina, and in a lot of cases it can help us get much clearer views that we may not be able to get transabdominal. At your first antenatal booking visit, you will meet myself or one of my sonographer colleagues. All of the sonographers that work here are either clinical midwife specialists or radiographers with specialist obs and gynae training. At the first trimester booking scan, it is a dating ultrasound. It is not a detailed anatomy assessment of your baby. You will have a more detailed, comprehensive assessment of your baby's anatomy when you're approximately 21 weeks gestation. But for the first visit in the hospital, the scan initially is to check to make sure that there's one baby in the correct place with a good, strong heartbeat. If there's more than one baby, we will tell you that news there and then. And it's a pelvic ultrasound, so we will be looking at the uterus, the ovaries, to make sure that there's no ovarian cysts. If there's any fibroids there in the uterus, we'll be able to identify, measure and image them. And there are certain parts of your baby's anatomy that we might be able to see at the first trimester booking scan. So from some angles, the baby looks like a baby and you're able to see the head and the body, the arms and the legs. If the baby's in a really optimum position, sometimes you can get a nice side profile view of baby's face. You might see the hands and the feet. As well as that, we look at the amniotic fluid around the baby, where the placenta might be developing, and we might be able to image the cervix or where the cord is attaching to the placenta as well. Not all of those images are possible to get on the first trimester for every lady, but certainly that would be for an optimal booking scan. Ultrasound is considered a very safe imaging modality for your baby. The sonographer doing your scan will ensure that the settings on the machine are correct and kept at very safe levels for your baby. It's the responsibility of the sonographer to ensure that we minimise the scan time that your baby is exposed to ultrasound for, and whilst also ensuring that we get the images and the measurements required to reassure you and reassure us that baby is developing correctly and looks healthy. Sometimes we do have to apply more pressure onto your abdomen to get clear images. I know for some women that can be a little bit uncomfortable, but it's not going to damage your baby, and the pressure that you feel on your abdomen from us pressing on your tummy, your baby will not feel that. Your baby's well protected, floating around in a nice big swimming pool full of fluid, and won't be feeling the pressure that you're feeling on your abdomen. The reason that we don't play the heartbeat for you to hear at less than 12 weeks gestation is because at earlier gestations, your baby's primitive organs are still developing, and ultrasound can produce a lot of heat. If we are to apply the power Doppler to allow you to hear the baby's heartbeat, that potentially emits a lot of heat to the baby for that period. So it's not considered safe to do at less than 12 weeks gestation while your baby's organs are still developing. And that's the reason why we don't play the heartbeat for you at less than 12 weeks gestation. So if you come along for your booking visit scan and you're 11 plus weeks, you won't be hearing the heartbeat. There is a very safe method for us to assess the heartbeat using M mode, and you will be able to see the flicker of your baby's heartbeat on the screen, and the sonographer will show that to you clearly. But at less than 12 weeks gestation, we won't be playing the heartbeat for you to hear. If you're between 12 and 14 weeks coming for your booking scan, you will be able to hear it. It is considered a safe time to play the heartbeat.
My name is Liz. I'm an obstetric registrar working in the Rotunda Hospital, and I'm also a clinical tutor working for the RCSI. Usually in an early pregnancy scan from around 7 to 10 weeks, type of twins, so if they're identical or non-identical, is best identified before 14 weeks gestation, as this can have implications for the management of the pregnancy going forward.
Hi, my name is Debra. I'm one of the advanced midwife practitioners here at our emergency and assessment unit at the Rotunda Hospital. Many of you will know my face from coming in and out, hopefully for good reasons. I work in the unit for the last few years, and I see a lot of early pregnancy patients coming through our department. Most of the time I give some really good news. Sometimes I give some bad news, which can be very, very difficult. So I suppose we see a range of patients from 0 to 42 weeks pregnant. Sometimes we see patients after when they have their babies, and sometimes we see babies for the first 2 weeks of their life. Part of my role is to assess and care for women in early pregnancy when they present to our emergency department. Women present to the emergency room in early pregnancy with complications such as pain, bleeding, and nausea and vomiting in pregnancy. In some pregnancies, doctor or midwife may recommend that you need a scan before 12 weeks, but in normal pregnancies with no complications, a scan at 12 weeks is what we recommend. It's the best time to get the appropriate crown rump length, which is the gestational age of your pregnancy.